My name's Rena Sweeney and I'm the Agency Director of Bridgend County Care and Repair. The agency has been in operation for over 30 years, helping older and disabled people through the process of repairs, improvements and adaptations to their homes. The hospital to home service is very much a housing-based service based within the Princess of Wales Hospital, supporting people across the county borough and reflecting the ethos of the care and repair movement across Wales.
The beauty of the service is that we're actually present here at the hospital. We're on the wards daily, talking to patients, talking to the staff, and we receive a number of referrals from the occupational therapists, from the physiotherapists, from the staff nurses, and sometimes from the patient themselves. The work that's usually identified is urgent for discharge, and that patient can't go home until that work has been done. Every morning we have a home safety officer in the car park ready to go for the day to carry out his work, and the work is usually completed, if not within 24 hours, but certainly within 48 hours of the referral. We also receive a number of referrals from Bridgend Day Hospital, where patients there attend from the community and they're frequent fallers. So we receive a number of referrals for home safety modifications for those patients as well. We attend ward rounds daily, so patients are identified to us sooner. So we're able to plan as part of the discharge process to have the work carried out more effectively. Once the patients have been discharged home, we then carry out a post-discharge visit, where we carry out a full assessment including a healthy home check, a falls risk assessment tool and also a welfare benefits check. We've gone to maximise their benefits, and since the service has been in operation, we've raised over £1 million in unclaimed benefits. Some of the patients go on to have larger scale adaptations through our occupational therapists, including things like level access showers, wet rooms, ramps, and this involves our technical team who come out and draw the plans and then help the patient through the process of having the works carried out in their home. Hopefully, once the patient is home and has received a range of adaptations, minor and major, including the welfare benefits maximisation and signposting onto other services, they're able to stay at home longer and more independent, and hopefully without the need for readmission.
We have caseworkers coming around to the ward every day, so we know who we're talking to and they're easily accessible to us as well. In terms of patient flow, the services absolutely helps. But sometimes we're making decisions on the day, so we're knowing that we suddenly see a patient and we know that they need to go home today, and we can pick up the phone, we can go to the office of the caseworker and say, this person, really sorry, needs to go home today. What can we do to expedite that? And 9 times out of 10, it's right, okay, we'll be there within an hour, within 2 hours. That caseworker following that person out and then perhaps looking at a few things that hadn't come to the forefront when they've been in hospital absolutely prevents that person coming back in. It's that trustworthiness of knowing that the person that's going into that individual's home knows what they're doing as well, so that they are reliable when it comes to the carpentry skills or the electrical skills. And so I think it gives we've got a broader scope, if you like, of what they can look at in an individual's home than what we would do from just a piece of equipment.
I'm Stuart Pickford. I'm a home safety officer. We do adaptations in the community for people to be discharged from hospital. Satisfying because it enables people to come home earlier. We're obviously freeing up a hospital bed and enabling people to come home and live independently. You see the improvement in people's lives. You know, it obviously is reassurance for the family. Adaptations have been put in place to make their lives easier and safer, and most people don't want to spend any more time in hospital than they have to, so the sooner they go home, the happier everyone is.
I didn't know what had gone wrong. He wasn't very well, and what did I do? Did I ring for a doctor?
Yes.
Rung for the doctor, and the doctor came out and he diagnosed, and he said I need him straight into hospital. And of course he'd had this stroke. Care and Repair got involved with us through the hospital and through the occupational therapist. Before Bill was discharged, they came in with and they put a lifeline in, and they also came in and they did the outside, they did the steps front and back and handrails onto the door to help him in the house, and then they put handrails all up the stairs as well for him.
I first met Bill when he was in the hospital. We'd had a referral from the occupational therapist. After about 3 weeks, I made an appointment to come and see him, and it became apparent that Gwyneth Bill's partner wasn't going to be able to cope after the carers had left with bathing because they had a bath with a shower over it, and he couldn't do that on his own, and due to her health problems she wasn't going to be able to help him, and she was at a real low ebb then, wondering what was going to happen. Once the occupational therapist had made that assessment, the work was carried out, and that was all done within a couple of weeks, and then that helped him. He gained his independence back, that he could do this, and obviously the stress was taken off Gwyneth. So I completed an attendance allowance form for both of them because they weren't claiming any benefits, and they've just been awarded the high rate, which is going to make a massive difference to the two of them, especially now because Bill nor Gwyneth can drive, and if they have hospital appointments or doctor's appointments, it means that they have to have taxis or rely on family.
Well, it's made things a lot easier for us. I haven't got the stress and the strain like I had trying to do things for him. It's easy.
I'm 80 years old, I'll be 81 in January. As the years have gone on, I get more creaky. I've got arthritis in my hands and osteopenia in my back, and I get giddy spells. And I thought life would just go on like that, but I wasn't very well at one time, and my doctor referred me to the Princess of Wales Hospital. On my referral, they put me in touch with Care and Repair, which is a wonderful thing. It's really been helpful. It was through Care and Repair I received my lifeline. It's really given me confidence. If I did have a fall and I was in the house on my own, I know I just have to press it, and I don't know what it is that goes through, but it's magical, and somebody would come and help me. I was lucky to receive the attendance allowance, which that helps a great deal as well, and it gives me a lot of confidence. I know I can stay in my own home for as long as I want, maybe for all the rest of my life.
I deal quite regularly with the Care and Repair team here, and having them based in the hospital is really helpful for us because we can pop down, chat to them there and then about getting things arranged and sorted so that we can get our patients out of hospital quickly, efficiently and safely to prevent any complications of staying within the hospital environment.
I'm Louise Ebenezer, Parkinson's disease nurse specialist for Bridgend County. I find the Care and Repair service invaluable for my patients. I see my patients in community clinics, hospital clinic and in their own home, and when they have a problem with activities of daily living and can't function normally, I will refer them to Care and Repair for adaptations or equipment in their own home to keep them independent for as long as we possibly can. The patients will ring me to say they can't turn over in bed or they can't get off their chair, and then Care and Repair will go and provide the necessary assessment and provide the necessary equipment. I can refer somebody on a Tuesday afternoon, and by Wednesday Care and Repair may have made an appointment and gone in to see them.
I primarily deal with discharge from hospital for older people. We find the service fast and very flexible, and it obviously frees us up if we can refer on for certain things like telecare and welfare benefits advice. It frees us up to arrange things like the package of care. So we find that the two work very well together in parallel, and it does speed up discharge.
I think what we need to remember is that many patients come to the hospital and their need is very straightforward. They come in, they have the surgery and they go home. My general experience is that the older the patient gets, the more chances that their admission to the hospital leads to a more complicated need for when they go home. It becomes a bit more of a life event. In the last year, we were able to use Bridgend Care Repair for 1,400 referrals for patients who've come into the hospital. The service is called hospital to home, and the danger in that it implies that we're talking about an end point, hospital to home, and that's it. It is not just a discharge. In my experience of the great services provided to the patients, therefore to the hospital, the service is far more wraparound than that and will help put mechanisms in place providing, to an extent, emotional, pastoral care and wellbeing advice and support that may lead to ultimately a prevention of admission back into the hospital. I'm keen to find out how we can do far more of services such as this with Bridgend Care and Repair. I think they are pivotal an example of how we can work together in partnership with multi-agencies, health, social care and the third sector, to make sure we put patients at the centre, we fully understand their immediate needs whilst they're in hospital and going home, but also their ongoing needs, to provide that service and support in the community that hopefully for them prevents the need to come to hospital unless they have a true medical need for that.
To go without having a caseworker in the hospital now would be a massive backward step when it comes to patient flow and to the patient experience as well.